Hey there, Dr. JP Guidry here. I want to talk a little bit about throwers out there experiencing arm pain. So shoulder pain, elbow pain, even wrist and hand pain. Number one, we want to assess the area and make sure there's nothing major going on, nothing that needs further investigation into that area. Once we kind of rule that out, the approach typically is, so a lot of times in typical rehab, you're going to do some light band work, some light dumbbells, some pretty basic stuff. And for the most part, you're going to be doing those way too long. So my approach is, number one, I want to calm the pain down. So some of that is eliminating the aggravating activity. So if it's throwing, we might need to stay away from that for a while, or definitely lower our volume with that. Within that, we want to start to restore movement. So if there's any movement limitations, whether it's with pain or just mobility, then we want to start to restore that and alleviate that pain with that. We want to keep you training around the injury. So anything you can do to keep training, to stay in the gym, to keep moving, whether it's upper body work, obviously lower body work, core work, things like that you can do. Keep doing that. Do not stop. Okay. Once you start feeling better, we want to start to load the area, and these are going to cross over. It's not like you got to check this box to move on to the next one necessarily. So we start loading the area first with isometrics. So that's going to be holding against the resistance. Starting lightweight, longer holds, and kind of building up the load to shorter holds there. We want to add in some eccentric, so that's going to be, if it's an external rotation, that's going to be, pulling out or setting it out, and then the weight pulling us this way, and we're controlling that weight with a band or on our side with a dumbbell, whatever that is. Slow control, and then we may have to help it back up if it's weak or painful. Okay, we start to restore some movement, some strength, some tissue tolerance with that. If there's any nerve issues, we may do some neural glides, things like that, again, to calm the area. And then once we start to progress load, it starts to feel better. We want to restore just full strength. We want to start to load the area heavier and heavier as it's tolerated. We want to start to return back to your full normal training. And then we want to start throwing. So if you haven't been throwing, we want to return back to a graded throwing program. Okay, this is going to look different for a lot of people depending on the severity of the injury, how long you've been out, things like that. And we want to assess mechanics while we're doing that. So obviously we can assess mechanics before, but sometimes if it's too painful, we may hit to hold back on that. But if there's a mechanical issue that's creating or contributing to that pain, we want to address that as well as you return back to your normal throwing program. So again, stay off the light band. Some of that stuff may be necessary early on, but we can definitely take a different approach than the typical rehab approach to shoulder and arm injuries, where it's the same basic stuff, going through your basic band movements for weeks and months on end. Okay, so assess, restore, and decrease pain. Continue training around the pain as much as you can. Start to load the painful area, eccentrically, isometrically, and then returning to full concentric loading and increasing that load, increasing that weight, and then a graded return to a throwing program while addressing and assessing mechanics with that.